God's plans in our lives are seldom predictable. Who would have thought a year ago that the church at Dwaleni in Swaziland would today be actively involved in an AIDS program? But as Julie Andrews sang in the well-known song, let's start at the very beginning. Swaziland is the country with the highest HIV infection rate in the world. Even a 5-minute visit to a hospital in Swaziland is enough to make one realize the shocking effects of this disease on the population. I started many years ago with intensive research about the effects of AIDS on Swaziland, and this led to an invitation to lead a number of workshops about this topic during the General Assembly of the Reformed Ecumenical Council, which was to be held in Utrecht in the Netherlands during July 2005. A large number of Reformed churches from all over the world attended this conference. The theme of the workshops was Towards a Theology of AIDS. While busy preparing for this conference, as well as during the discussions which took place at the workshops, I started to experience how the Lord was changing my own life. What had started purely as academic research evolved into a passion to make a difference in my own country. The breakthrough came when we visited a church in Rotterdam one Sunday morning. Rotterdam is one of the busiest harbors in the world, with all the normal challenges of such a large city. The congregation, and especially the minister, impressed me with their passion for the poor and the needy of this busy city. While reflecting on what I had experienced that day, I knew without a doubt I wanted my own congregation to be like this. We had to become a congregation where Christ will be experienced by everyone visiting us. Furthermore, we had to move out of the church building in order to become the hands and feet of Christ in the community. With this vision, I returned to Swaziland. Shortly afterwards, a group of Christians from a congregation in Middelburg and Mpumalanga came to visit us. I shared my vision with them, and it soon became clear that they were also touched by the need of those with AIDS. This visit was probably the first confirmation that we had from the Lord that we were moving within His will to become involved in the community in this way. Virtually every Sunday after that, I shared my vision with the congregation during my sermons, and it became clear that they were also excited by this. The Swazi people are generally very caring people, and to make this vision part of the formal structure of the church made sense to them. The big question was, what should we do? One possibility was to start with a feeding scheme. In other parts of the country, hundreds of children are being fed daily. But is this really what the Lord wanted us to do? We were not sure. Eventually we decided to organize an AIDS conference. Perhaps God's will would become clearer for us after this. And so it happened that the conference was held on 19 November 2005 in Wyngaard in Swaziland, addressed by a variety of people. After the formal speeches, the attendees divided into smaller groups, and when it was time for a response from them, the answer was clear: home-based caring for those suffering from AIDS and other serious diseases. Corrie Oosthuizen, director of an NGO known as the Project Support Association, with its office in Bethel, then assisted us in doing our initial planning. A few weeks later, on 3 December, a number of people gathered at Dwaleni, and the overwhelming feeling was, let's go ahead. We will care for the people at their homes. My task was, organize training for anyone interested in joining this project. To organize the training was fairly easy. Corrie and her team were willing to assist us. But oh dear, we had completely forgotten something extremely important. According to Swazi custom, we would have to feed all those attending the training for the entire week, and we hadn't planned for this. Furthermore, we had no money to buy the food. However, a miracle happened. 2 days after the decision was made, someone paid money into our church account with a note, Dwaleni AIDS Project. A further 2 days afterwards, an anonymous check was sent to me to use for this project. Now we had enough money for the training. Without ever mentioning our needs to a human being, God had provided the necessary funds to proceed with our plans. In the months to follow, we would experience this miracle over and over again. When the training started on 23 January, 21 people turned up to be trained as caregivers, 1 person more than we had prayed for. On the Tuesday, the number had grown to 26. On Wednesday, 36 people turned up. The message of our vision was spreading throughout the community. Using formal lectures as well as less formal training sessions, the students were motivated to get involved with the sick and the dying. The local Member of Parliament, Mr. Magwagwa Mdluli, together with his wife Futi, both people very much involved in the fight against AIDS, also honored us with their presence. Representatives of the Swaziland Department of Health as well as the United Nations also came to hear what we were doing. And of course, now we were able to feed all those who attended. On Sunday, 26 February 2006, a Thanksgiving service was held at Dwaleni. Because the church building is too small, we had to pitch a tent so that the people of the community could also attend. In my sermon I preached about the 4 men who took their paralyzed friend to Jesus for him to be healed. During my prayer that morning I prayed in the words of Moses, "If your presence does not go with us, do not send us from here." We then handed out the certificates to all those who had attended the training to become home-based caregivers. 32 volunteers are going out on a daily basis to visit patients at their homes, to wash and to feed them, and to give them basic medication. More than 300 people are being visited, some daily, some once or twice per week. Most of these people are chronically ill. Almost half of them are terminally ill. With regular intervals we also received the sad news that another of the patients had passed away, but we rejoice in the knowledge that we were able to make a difference in such a person's life. In the meantime, some of the leaders of the community had also approached us with a request to start with a feeding project for AIDS orphans and other vulnerable children in the area. This was truly a test for our faith, because we agreed to start this project without any means through which we could obtain food. But once again, God provided in our needs. We started receiving bags of maize meal, and presently nearly 300 children are being fed at the church 5 days a week. As more and more people hear of God's work, help has been offered by way of clothing, blankets, food, medical supplies and other essential items. Professional people also came forward to offer their expertise in order to further improve the service given to the community. What does the future hold? We're not sure. This project will be a daily walk with God. We trust Him to lead us all the way. Presently, none of the caregivers receive a salary. At most, they receive a small stipend as token of thanks, and from time to time they are blessed by other items such as food and groceries for their own use. But we believe that the Lord has brought us to this moment. There is no need to doubt that He will continue to guide us in the future. What can you do? First of all, we ask that this project will take a prominent place on your prayer list. More than anything else, we have learned the need for total dependence upon God in a project such as this. Furthermore, we would like to invite you to visit us and see for yourself what is happening. Our basic day-to-day needs are for food, clothes, blankets, and medical supplies such as antiseptics, painkillers, and multivitamins. We also need help with the church building from where the work is being coordinated. In 2005, a hurricane caused tremendous damage to the structure. Most of the damage has been repaired, but the building is more than 100 years old and urgently needs to be renovated. And then we also dream of the day when our vision will be displayed on this building for all to see. But in the meantime, we continue with the work, believing that God, through us and through you, will make a small but essential difference in Swaziland.